Hi, this is A.Loggins with Module 6 homework for Class 610 Psychopharmacology. Right. Medication noncompliance is the act of a patient not following through on the correct dosage of a prescribed medication or even taking it at all. There are a number of reasons as to why a patient would be noncompliant with their medication. These reasons oftentimes include inherent disregard to compliance along with accidental noncompliance. Risks are associated with medication noncompliance and can greatly affect the outcome of a treatment plan as well as life in general. Physicians don't prescribe medications just to write a prescription, they write them with a purpose. Strategies become useful for physicians when trying to work with their patients in regards to medication noncompliance and getting them back on track and keeping them there. Patients who are new to taking medications often forget about taking them. For about half of the patients, this is unintentional as they skip doses due to forgetting the addition of a medication. Organization plays into the forgetfulness to take a new medication. For the other half of patients, they're concerned about the side effects or just taking medication in the first place. The concern about taking a medication can spawn from the fact that patients didn't have enough information about the drug prior to being prescribed. This responsibility falls on the doctor prescribing the medication along with the pharmacist who is filling the prescription. Some of the non-compliance spawns from the patient experiencing side effects that they were not aware of, so they instinctively stop taking the prescribed medication because they think something is wrong. In the United States, the rise of drug costs have also shown to be problematic for some individuals to continue the use of a prescribed medication due to financial concerns. Another obstacle that creates patient noncompliance is the ability to get their prescription filled or even picked up from the pharmacy. The frequency and number of pills that the patient must take to meet the prescribed dosage is another concern when it comes to patient noncompliance. Another common issue that arises with individuals and them not taking their medication spawns from denial. Denial that one's health is not in tip-top shape, denial that something is even wrong with them, denial that one can't fix their own health issues on their own. There are also a number of risks involved with noncompliance of medication. Not taking medication as prescribed can lead to numerous other problems that more than likely will require even more medication to alleviate. There are a number of health issues that require daily medication, and without it, it puts one's life in jeopardy. For instance, an individual who is diabetic and requires injections for insulin, if they don't take it, they're risking going into a coma and ultimately risking their life. The same goes for individuals who have heart issues. Without the proper medication, the flow of blood through their heart, or the lack thereof, could cause serious concerns and even life-threatening issues. Not all cases of medication noncompliance are life-threatening. There are some that drastically affect one's quality of life. People who miss taking medication for anxiety or depression are essentially making life harder on themselves. Yes, medication does not solve a mental health issue. It is, however, used to help keep the mental health issue at bay and make it easier to cope with life on a day-to-day basis. Medications are prescribed by a doctor with a purpose. Medications don't help people who don't take them. With a number of reasons, obstacles, and risks for noncompliance, there are also some strategies that can be put into place in order to assist patients with improving their noncompliance with their medication. The first strategy for a prescribing physician to try is to simplify the regimen of medications. The number of medications that can be prescribed with an extended release feature, so the patient only has to take one pill a day instead of multiple times throughout the day. The fewer times that a patient needs to remember to take a prescription, the more likely they are to comply with the medication dosage. A physician can work on compiling a reward and recognition system for their patients who are compliant with their medication at least 80% of the time. Enlisting support from friends and family to help the patient keep up with their medication is also another option. Sometimes a simple reminder is all that's needed to remember to take one's medication. Out of all the strategies listed here, I believe the most important strategy is the relationship between physician and patient. Having a strong physician-patient relationship is so important on so many levels. The patient is able to feel more relaxed and have a better understanding about what's going on with their treatment. This relationship between the physician and patient is more important than patient education. If a patient feels like they're part of their treatment plan, they're more likely to stick with the program. Physicians and pharmacists can educate patients on medication all day long, but if the patient doesn't understand why their physician wants them taking the medication and what it'll do for them, they're less likely to stick with it.